an investor doing things on your own? How about someone working with a firm that isn't so responsive or in sync with your investment philosophy? My podcast talks you through all things financial. Look, there's stuff you don't deal with very often, but investments, insurance, and retirement is something we plan for each and every day. This is the PennyWise Financial Podcast, and welcome to the show. Good morning and welcome to PennyWise Financial Podcast. This is Constantine here with Monarch Wealth Management. Welcome to the show, Jason.
Hello, how are you, Cons?
A little bit better than fantastic, especially with this new bill that was passed, right?
Yeah, relief package. Let's see what happens.
So I get home last night, and the very first thing my wife says, "Can you believe the bill passed?" And I said, "Well, what's in it?" And it's been modified a few times, right?
Yeah.
Right, I know. So it's 1.9 trillion. That's what we know so far, right? In most of these bills, when they're passed, they go through a transition, I guess, if you will, where they have the initial offering, which is usually filled with a bunch of bogus stuff that gets eliminated, right? But they know that going into it, because it's all part of negotiation, right?
There's a lot of politics in there.
Yeah, there is a lot of politics, I'm sure. Obviously, like most things with these bills. But let's take a deeper dive into what is actually in the bill and what we think about it. So it looks like some of the highlights are direct payments of $1,400 for a single taxpayer, or $2,800 for a married couple, and then $1,400 per dependent. You know what you're seeing?
That's what I'm seeing. Yep, for a single individual, up to $75,000, married couple up to $150,000 combined income.
So those are direct payments to people, putting cash in their hands. I just want to think about that aspect for just a minute, because we've done this already. This is round 3?
I can't even count. There's been so many.
I think it's round 3. I don't know.
Yep.
And I know they've had different caps on how much you can earn. So this one is basically up to $75,000 as a single person. And then what was it for a couple?
150 combined, yeah.
Okay, and then you get the full payment. You get the max payment.
Yeah, $2,800 for a couple.
So it's $2,800 and then $1,400 for dependents. So that's a decent amount of money. But if you're making $150,000 a year, if you get $3,000-$4,000, do you think it's changing your life? I don't know.
I don't think so. I don't think so
either.
I think the money should be going, and I like the unemployment benefit aspect of it, of the $300 per week. It is down, it says, from $400 per week previous. But those are the people that I think need it more. If you're employed, okay, great, I'm getting a $1,400 check, but do I really need it? No, I'm still working. I'm okay. Like, why are you sending me a check? That's what I don't understand about it.
I had this conversation yesterday. What do you think people are doing with that check?
Yeah, they're spending money. They're spending it in the economy.
What do you think they're doing? Like, are they buying things? Like buying new TVs, buying a new couch?
It depends on depends on their finances, I guess. Somebody that might have enough in savings that says, let's go out, on a mini vacation, maybe go to a hotel over the weekend or something, spend the money, or spend it, maybe we can buy that couch we wanted to get,
Airbnb.
Yeah.
Maybe.
Something like
we
that.
Looked at a few, we considered it. And I like the idea of the concept of Airbnb better than a hotel, like a massive resort, just because you'll have your own house, right?
Yeah.
You bring your Clorox wipes, which I know my wife will bring that, a couple boxes, some spray. Everything will be disinfected, and we can enjoy it. But I don't know. I don't know that a lot of the people receiving that money are actually spending it in that way. I think they might be paying down debt. I did read an article that said that consumers are now reaching the point where they've had the lowest debt in a while, lowest credit card debt.
Yeah.
So it could be a combination of paying down those debts so they decrease the amount of monthly payments they need to make once they are back on a regular schedule.
Yeah.
That'd be great. I also think a lot of that money is going back into the stock market. I really do.
Oh, okay.
I believe it is.
Mhm.
I don't know that people are spending it as much, like buying. There's only so many TVs you can have in your house.
Yeah. No.
By the way, how many TVs do you have in your house?
In my house, we have 4.
So we have
Every room.
got one in the family room,
Yeah.
got one in the sunroom, got one in the bedroom, got one. We got 4 TVs.
Mm-hmm.
We've had those TVs for just about a decade. One of them I've had that's maybe 12 or 14 years.
Yeah.
Good TVs. But anyway, we're getting off topic. So they're putting this money directly in their hands.
Yeah.
And the idea, I would assume, the concept here is, let's put money in these people's hands so they can spend it, which encourages companies to obviously be profitable, have staff, have employees, keep people employed.
Yeah.
Growth. I just don't know that that's a direct solution. But anyway, that's one part of the bill. Next part, and you alluded to this, is aid to the unemployed. See, this is where I think it would be a bigger benefit, because it keeps things somewhat stable, somewhat normal. If you're unemployed, like that $300 a week plus whatever benefit you get, if you get a check for $3,000 and you're unemployed, I think that's a pretty big deal. I think it would go much further there.
Definitely.
I don't have a problem. That I actually like.
Well, I was talking about the $300 per week added to your unemployment benefit you get, which, I don't know if you remember, but in July or even earlier when it first started, it was $600 added to your unemployment paycheck, I believe. And people were saying, well, I'm getting paid more now by staying home than actually going to my job, which I think is okay as long as it's limited.
Yeah.
But if you extend that period, and I think it was smart of them to lower the payment, because I think a lot of people were saying, well, I'm not going back to work because I'm making more now. I'm going to ride this out.
That's right. So how did that benefit? And I know there were iterations. It changed. At first, I think the $600 was like a tax-free benefit, right? And then they changed it and they said, oh, no, it's taxable. And that $600 a week was on top of whatever benefit they got, right?
Yeah, in unemployment, in their unemployment.
So let's say they got $400 a week in unemployment.
$1,000.
They get $1,000.
Yeah.
And they didn't have to go to work. They didn't have to wake up early. They didn't have to show up. They didn't have to do a thing.
No.
But it promotes that kind of behavior, like, hey, I could do nothing and still just get paid.
Yeah.
I don't know that I'm in love with that type of structure. But you're right. So they lowered it. They brought it down to $300 a week. Is that still in effect?
Yeah, it says here that in the new package here, it's down from $400 to $300 per week.
So that's going through September 6th.
Yeah, that's what I see.
Okay, yep. So there might be an end in sight, and I hope that does happen. So this is aid to unemployed, extension through September 6th, additional $300 a week. I'm good with that. I think those people deserve the money. They need the money. And then what other benefits?
Well, with the way the vaccines are going too, I think by September 6th that the country should be, as long as everything is going the way it's been going, on a track back to recovery and back to actually where unemployment is back down and we're not needing these benefits anymore, hopefully.
I think there might be some job displacement, right? Because people are traveling less.
Yeah.
Just in general, like businesses are realizing, hey, geez, I don't got to send Mike and Susie over to California every other week to, wholesale the product.
Yeah, we got Zoom.
Just as effective. I don't know if we're kind of old school though. Like the generation we grew up with, we're loyal.
Yeah.
It means something when you see and your handshake, your word meant something.
Yeah, face to face.
Yeah. But now I think there's less loyalty just in general.
Yeah.
Like whether it's shopping for an investment advisor, a doctor, a dentist, a lawyer, anything you could imagine. If you can get a cheaper price online with a couple clicks, I could save an extra few bucks.
Oh, yeah.
And I talked about this with my father-in-law. So my father-in-law is from literally old school. Yeah. Like he was with a State Farm agent for 20 years.
Yeah.
And he made a few changes afterwards when he realized that that guy just couldn't do anything with price. And I think Dave, your brother, went through the same thing.
Yeah.
I experienced it. I was with Liberty Mutual for, I don't know, maybe 9 years.
Mm-hmm.
My rate doubled.
Yeah.
And I was able to cut it in half and then some.
Yeah.
And I said, hey, could you do anything? I've been a client a long time. Nope. If you can get a better rate, just go ahead.
Yeah.
And so I did. But another thing on here when we're talking about insurance is this aid to the unemployed folks. Looks like the first $10,200 is non-taxable for households that make under $150,000. So again, we're not tax preparers or CPAs, but it looks like there might be some additional tax benefits. But then on top of that, there's 100% subsidy of COBRA, the health insurance premiums, to help for those folks that are laid off. So, and that all runs through the end of September.
That's huge.
Insurance is huge.
Yeah, that's very huge.
I've got a problem when your premiums for healthcare cost more than your mortgage, your house that you live in.
Yeah.
And that's the reality.
That's a whole other topic.
That is literally the reality in my household.
Yeah.
Anyway, with that, let's take a quick break and we'll be right back to the show.
The stock market leaving you confused about what to do and how to plan for the unknown? We analyze the market every day and go to work for you, our clients. Listen to our PennyWise Financial podcast to learn how we battle market downturns and what we're doing right now with our portfolios. Protection is an important part of investing, and with this new COVID environment and the raging market returns, that gives people the assumption that things only go up. Listen, share, and subscribe to keep up on the latest.
Welcome back to the show, PennyWise Financial Podcast. Constantine here, joined by Jason Georgiev.
Hello.
Okay, so we talked about some of the aspects in the bill. This new $1 trillion massive COVID relief package, I guess is what it's called, right?
That sounds really
important, right?
Yeah.
And don't even try to go against this bill or any aspect of this bill because you're going to be a COVID hater, right?
Yeah.
You're going to be a non-believer.
Yeah, that's what we were talking about before.
So more checks. What else do they got in this bill? I'm just trying to.
We talk about education. Is there something in there about education?
There is. Let's start there. So tell me what's in the bill. What you see on education.
$128 billion in grants to state educational agencies, with 90% allocated to local educational agencies, plus $39 billion in grants to higher education.
So grand total is how much? What
128.
128. Okay. So that is to help schools reopen?
I guess so.
What does that? Okay, so I'm looking at
No,
this.
it's very vague.
It's very vague. Hey, we want to help kids. We love school.
Yeah, here's $128 billion.
A check.
I'm sure there's more to it, but
I gotta imagine some of the unions are helping to support this and maybe have had this administration's ear to some aspect, right? But what does this actually help? Let's go through this. The bill calls for about $130 billion, give or take,
okay.
in additional aid. The money will be used to reduce class sizes. Okay, I can understand that. Modify classrooms to enhance social distancing, to install ventilation systems, and purchase personal protective equipment. So masks, gloves, shield, sanitation or sanitizing stations, maybe?
That doesn't make any sense to me.
No?
No, because I understand the ventilation systems
Mm-hmm.
for future outbreaks if something happens. I know a lot of these schools didn't have the ventilation systems like the city schools. That's why they had to close the schools.
Why not? Were they just old?
They were older ventilation systems,
Okay.
and the circulation wasn't what it was supposed to be for COVID. It made it worse, so they had to shut the schools down. And a lot of schools fell into that predicament. So I agree with that, but why are we even giving money to figure out ways to social distance when hopefully this is going to be over by September?
That's my exact thought. That seems like a Band-Aid, right? Is that not like a Band-Aid?
Not
Unless they're
Band-Aid,
preparing
it just seems
for
like they're
something
burning
else.
money.
Maybe.
To me, I don't know. That's a
Maybe.
big waste to me. You're looking at the vaccines out, numbers are dropping, everything's going better, things are starting to reopen. Let's get on track to be positive about this and move forward, not just sit in this hole,
You
And
don't like your hole?
I don't like my hole. I can't see out of my hole right now. I got to get out of the hole.
I agree, man.
You
I
know?
agree. I totally agree.
I mean, it's ridiculous.
This plan does sound like it's designed to almost reshape in a way the school system.
Yeah.
And I hope not. Like you said, I hope this is a temporary thing. I want my kids, the younger generation, to experience the same things that we did.
Yeah.
The social interaction.
And I'm not saying don't be safe. Wear your mask.
Of course.
Wear your mask. That helps more than anything, I think, is spreading the virus and this and that. But I mean, it just seems like they're always trying to throw money at something that doesn't need to be taken care of. Like, we've already got most kids aren't even in school right now.
I know.
You know, like,
this is a debate that we have because we're not sure what's going to happen next year if we continue paying for private school or do we send them to public school, because the private schools are a little bit different than public. Yeah. They have the right, if they want to continue sending the kids, have their own safety protocols. But even then, they could scale back if we have a massive outbreak or something crazy happens.
Yeah.
Then it goes on to say the money could also be used to increase the hiring of nurses and counselors to provide summer school. So is that like...
To provide summer school?
To provide summer school.
Well, I'm sure there'll be summer school. I mean, even last year there was summer school.
There was, right?
Yeah, but it was remote.
Of course.
Because my girlfriend, Casey, is a teacher and she worked summer school, but it was remote and it was limited. They didn't pay her full pay.
Oh.
It worked out for unemployment where she couldn't collect because she was still working a certain amount of days. And that was another system for unemployment that was really messed up, especially for teachers. A lot of teachers really got screwed on their paychecks.
So that's what I'm wondering. If we have all this money, we said $130 billion. $130 billion would it be? And we talk about like where the money's going, class size. Who's actually getting that money? It doesn't sound like it's the teachers, right?
No, of course not.
Right?
No.
So it's just like magically disappears off the balance sheet, right? And then it goes on to say spending for colleges and universities will be boosted by $40 billion. The money will be used to defray institutions' pandemic-related expenses and provide emergency aid to students to cover expenses such as food, housing, and computer equipment.
Mm-hmm.
So is that the additional computer equipment that they would need to
do what?
Go to school remotely, or as if they didn't already have it? I doubt they're providing that money. But that's $40 billion. And a lot of these bigger universities, I don't know who's getting this money. They have massive endowments.
Yeah.
Massive. And they never spend the money.
Yeah.
It just
like
continues
they need
to grow. Continues to grow.
Yeah, it makes no sense.
Like, do you think this money is going to, let's say, community colleges?
No, but that's where it needs to go.
Probably not. But I bet you some of the big league schools get some of this money.
Oh, yeah.
Right?
Yeah, and they don't need it.
And then, so who else is getting money from this? Help for business. What do they got in there for business? You see anything? I see something.
$25 billion for new grant program for small business, restaurants, and other food and drinking establishments.
So the grant, so it's $25 billion. The grant gives up to $10 million per company. $10 million per company.
$5 million per physical location.
Okay.
With a maximum number of 20 locations.
So this covers payroll, covers rent, utilities. I mean, out of all the industries, this has got to be by far the most greatly impacted, right? Mm-hmm. Restaurants. Yeah. And even now, there's still a mandate, and I don't know the times, but isn't it like 11 o'clock you have to be shut down if you're a bar?
Yeah, but I don't know. That's not, I mean, even bars before, I think I was talking with you about it, were shutting down at midnight anyway. You know what I mean? So a lot of these bars are making big stinks, but you've really seen people staying out. People don't stay out till 2 o'clock in the morning anymore, you know, unless you're a college kid. That's a different story, but, you know.
Now, how about the restaurants downtown, I mean, locally in Rochester? Are they can you go in and eat dinner?
Yeah.
You can?
Yeah, I think so. I haven't been downtown in a while, but, you know, Webster, you know, outside areas, they're open. Places are open. Restaurants are open. Downtown, I don't know.
I don't know either. I haven't been.
I haven't been either.
There were a few places that we tried to make reservations to a few weeks back that just couldn't accommodate, or
were closed.
They were limiting the amount of people at the table. You couldn't have more than 3 or 4, whatever.
Yeah, limiting, definitely. I've seen that everywhere.
But some places have come up with some creative ways. Mm-hmm. Like I've seen this outdoor seating. Have you seen the igloo type things with like plastic? They're kind of cool. Different experience, but I will say anytime we've gone out, the food quality seems to be lower. Service is different. And the staffing, it seems like they're running a skeletal staff.
Mm-hmm.
I don't know if people...
Very limited menus.
Limited menu, too.
Mm-hmm.
And we're quite forgiving. I mean, you got to understand. I mean,
yeah, of course.
Came off a pandemic.
Of course. The only thing I don't understand is the bad service. That's the only thing I don't understand. What's the cause of that? COVID?
That's your pain point. Your pain point.
That's what I don't understand.
What else does it say about small business? The bill also provides $7.25 billion for PPP. Okay, we talked about that. Loans. This bill also provides nonprofits the ability to apply for loans designed to help borrow and meet their payroll and operating costs. Okay. And potentially forgiven. Okay, so, I'm okay with this part of it, this part of the bill. The most impacted aspect of any sector, really, restaurants, bars, and then, of course, you got travel and whatnot. But, okay, with that, let's take a quick break, and we'll be right back with the show.
Retirement income is not an endgame. It's only part of your planning. It's meant to carry you through a long and big part of your life that can't be filled with worry or concern that you'll outlive your money. The last thing you want to worry about after working the past 30 to 40 years of your life is money and having enough of it. Listen to our show and schedule a consultation to learn more about how we can give you the confidence you deserve so you can focus on the things you truly enjoy.
Welcome back to the show, PennyWise Financial Podcast. Constantine here, joined by Georgiev.
Hello, everyone.
Okay, so now, last segment of the show.
COVID relief.
COVID relief, 1.9 trillion.
Whoa,
with a T. COVID relief package. Okay, so healthcare subsidies. What are they talking about here? Parts of legislation.
Public health.
Okay, financial assistance for ACA programs would be considerably more generous. Sweetened subsidies last through the end of 2022.
Well, CDC is getting $7.5 billion.
And what is it? So CDC $7.5 billion for what? Research,
Center for Disease Control and Prevention.
Research.
Another $46 billion would go toward diagnosing and tracing coronavirus infections. $2 billion would go toward buying and distributing various testing supplies.
So who gets the testing? Like, is it sent to like a CVS, like across all the states, or local government, and then they distribute from there? It's vague, right?
Very vague.
Nobody really knows. Let's put something on paper and throw them a check.
Yeah. Well, if we look into it, we might be able to figure out where it's going, but I mean, I don't know. I'm weary of all of these. I feel like people skim somewhere here and there. You know what I mean?
Little for you, little for me.
Yeah.
More for me.
Yeah, 2 for me, 1 for you.
That's right. Tax breaks. This is in there too, right? So under the current law, most taxpayers can reduce their federal income tax by about $2,000 per child. A significant change would increase the tax break to $3,000 for every child 6 to 17. And $3,600 for every child under 6. Wow, so it's tiered based on age. Mm-hmm. Don't have your birthday.
Yeah.
I need that money. Oh, boy.
We're moving your birthday.
Okay. So looks like some direct payments. Then we got rental and homeowner assistance. The bill provides $30 billion with a capital B to help low-income households, unemployment, and afford rent, utilities, assistance, homeless with vouchers and support. They're also providing additional $10 billion for homeowners who are struggling with their mortgage payments because of the pandemic. So I'm not sure what that means. Are they going to relieve them of those mortgage payments for a temporary period, and it's just forgiven?
Forgiven.
I don't know.
I don't know. I remember people were complaining about that because they were taking the mortgage payment. What were they? And then once that was over, you had to pay it up front.
Pay it all back.
Remember,
a balloon payment,
like right away.
Yeah, that seems reasonable.
Yeah, definitely.
So I didn't have a job. I wasn't able to pay my mortgage. You're going to delay or defer it
by 4 months, and then
4 months, and then I owe you $10,000.
Yeah, exactly.
Yeah, it seems like.
And that was the big issue. I don't know if that was changed. you know. So
Well, they definitely did have some things where you could borrow more money on 401ks and things like that. They tried to create some liquidity for people that just didn't have the funds on hand, right?
yep.
And it's a shame. I mean, this whole thing just rocked the world. It really did. What else is in the bill that we should know about? Who is eligible? Yeah, I mean, the IRS has a whole page on this, on income limits.
We've covered pretty much all the big bullet points, right?
I think so too.
On there.
I do. I do think so.
Small business.
But do you think, okay, so now knowing how they're distributing the money, who it's going to, who's getting it, do you think they missed any areas? Is there anything that they maybe should have done differently?
Well, just the things that we said, you know. I mean, you really got to look into where the money is actually going and who's getting what. That's the problem.
You got schools. We talked about healthcare, unemployment, corporations.
Yeah, but where is that money going to those individual places? That's the
Good
thing.
question.
Like you said, like, is the student getting the money? Is it helping that student buy a new laptop so he can do remote learning? You know, if they don't have a laptop at home, you know, that's where you got to figure out, where's this money going? You know, not to the union.
No.
You know, so that's the problem on a lot of these. And then you're looking, you know, on this document, it's a 10,000 page document. Good luck.
Oh, yeah.
Good luck.
No one's reading that.
You know, good luck even trying to find it.
I can't find it. I don't know where it is. I'm sure there is a way to find it.
Is there even a real document?
Yeah, good question. Good question. But yeah, I mean, I'm hoping, like, as we get the COVID numbers in the reports, the charts are showing that things are going down. And there's one of the companies, one of the investment firms that releases these COVID numbers, and they looked at, and they've been tracking this. So think about this. I don't know if I've shared this with you before, but so they have a chart that shows the COVID statistics of mask wearing mandates versus non.
Yeah.
And quite honestly, the trend continues to be the same, and it's going down. So regardless of mask mandates or not, the numbers still follow, and they're heading south.
But are you looking at from when it first came out last March?
Yes.
To now?
Yes.
Okay, and you're looking at, I mean, not just the mask wearing, but in the last 2 months, a large number of the population is getting vaccinated too.
That's great.
So you got to take that into effect too, with the numbers going down.
Everything has got to help in some aspect, right? But then there's certain things that I think are just kind of that don't make sense, like the hourly thing I mentioned to you before, hospital hours and visitation.
Ridiculous.
I just
ridiculous.
Don't know what that does to prevent things based on time.
Especially in New York State, how crazy it's been, especially with the nursing homes and all that baloney, you know, with Cuomo and all that. How they were restricting so much. Like, I understand you're restricting the numbers because you don't know who's got COVID. You don't know who can be carrying it. You know, I mean, you can test for it. You don't know if the test is 100% accurate, you know, this and that. So you just try to limit the people going into nursing homes, which is fine. Okay. But you still have to allow your loved ones to see their family. So you have to make it accessible. You have to make it work. You can't just say, no, we're stopping it. I think that was wrong.
Well, they could find ways to make it safe.
They have employees there.
Right?
They get tested weekly. So how do they do it? So if you have somebody come in, I mean, it's not rocket science.
No, it's not.
You know?
It's not.
And I think rather than dealing with it, they just said, no, we're stopping it. You know? And then all these people are dying in nursing homes, and just a big issue that didn't have to happen.
I agree. You know? I think it's sad. I think it's criminal. You know, I'm 90 plus years old. I'm in a nursing home. All I know is my family. Yeah. I have deteriorating health. I have
because you can't see your family,
Alzheimer's, dementia, whatever it might be the onset of. And now I can't even see my loved ones. Yeah. The only people I actually know. So now I'm surrounded in a home by nurses and aides and whatnot that I have no idea who they are. Right? I'm out of my element. I have a declining health. And now you tell me I can't even see my family.
Yeah. It's
destroying them.
It is.
And I hope they ease up on that.
They
that,
did ease
to
up
me,
on
is
it,
terrible.
but I don't
It's just
think
horrible.
enough at this point. I think they should be a lot easier, and I think it should be going toward that direction where you can go and visit. Just be smart, you know.
That's right.
Walk in with walk in with a mask. It's not hard. When you're in the room with your loved one, okay, you can take off your mask, maybe, you know, depending on what the rules are. But I think people just go out of control with, you know what I mean?
Haywire, overboard.
Yeah.
Have you been to any sporting events? Like, because I have, my son Sebastian does a couple different things, like soccer and whatnot.
Yeah,
but
yeah.
everywhere we go, so they have a mask mandate.
Mm-hmm.
They take your temperature,
Mm-hmm.
like thermometer.
Yeah.
But you go into the grocery store, restaurants, anywhere you want, and
Mhm.
nobody's taking temperature. Like,
Yeah.
what does that actually do?
Well, are
Has
you
anybody
sitting-
ever been stopped? Like, wait a minute, Jason. You have a
Yeah.
fever.
Yeah.
Go home.
Well,
I have yet to see
My
it.
buddy was just stopped at, he works at a local grocery store, and they take their temperature every morning when they go to work, and he was 2 degrees higher. They told him he has to go home. Every morning.
Wait, he's an employee, though.
He's an
right?
employee, yeah.
And they sent him home.
And they sent him home because his temperature was 2 degrees higher. They take their temperature when they're going to punch in.
Wow.
Yeah, and they sent him home.
So what happens in that case? Like, is he paid sick
He has
time?
to,
Or
I think he takes a sick day. I'm not 100% sure, but he, you know,
does the
unless there's
stimulus
like a
bill send him a
COVID,
check?
yeah, maybe.
Is that buried somewhere? I don't know.
He has to fill out a form.
That's crazy. Yeah, I don't know. I mean, I think we're in uncharted waters. Like, nobody knows what to do, what's right, what's
Yeah.
not right. I get that. But to your point, I think that people kind of went a little goofy.
They're
and
still
overboard.
going goofy.
Still goofy.
You know, like with Biden and his whole everybody when you see him doing a press conference and they're up there at the podium by themselves and they're wearing a mask talking.
That I don't understand. Even local reporters. It's like 50-50.
I think they're trying to prove something like, look, we're, you know, wearing a mask. Everybody should. I get it, but that's a little ridiculous to me. Like, relax, you know?
It's more of a
Statement.
Yes. Yeah, like
You
a
know?
statement. Like to lead by example, quote unquote, I guess.
We're not idiots.
Correct.
You know?
Yeah.
I just look at that and I say, you're an idiot. That's it.
Call it like it is.
Yeah, bottom line.
And that's the Jason we know. He's calling things like it is. He's calling all the shots. But where do you see, like, ultimately COVID by the end of the year? I mean, do you think we're
By January
Yeah.
or September school
let's
year?
let's say December.
Okay.
You know, the winter months, they tend to, you get flu season, all that stuff. So there's other things that happen. Do you think we're over this where we're not wearing masks by the end of the year? I don't think so.
I think it'll be close.
I hope so.
I think the majority of the population will be vaccinated by the end of summer of the United States.
Which help. And let me ask you this. This is illiterate, but how long is the vaccine good for? Is it good for like 6 months, a year, 2 years, 5
I
years?
don't know. It can make you grow a third arm. Who knows?
So when do we know? Like, do those people that
Years.
so the people that have their second vaccine, do
Yeah.
they have to go back in and get checked on? Like, hey, do you still have these antibodies or whatever it is?
No idea. I've never heard of a number of how long it lasts for. I've never heard of, because they don't have the long-term data.
Well, literally, I mean, how many people have gotten their second vaccine? And it's just, I mean, it's new. Like,
Yeah.
maybe the last 2 months is
Yeah.
when people.
There are people getting this. I've heard of people that I know they've gotten the second vaccine. Some people say, a lot of people actually say they've gotten mild side effects, this and that. Some more severe than others. But as far as the longevity, I have no idea. You know, I don't think anybody has any idea of how long this vaccine lasts. It could be a season, could be 10 years. Who knows?
I'm hoping by next summer, by like May of 2022, we can go outside. Nobody's wearing a mask. You go into the grocery store. It's a life as we knew it before.
Yeah.
Or something like that. I think it'll be a little bit different. But anyway, we could go on and on. I think that wraps up the show. Constantine from PennyWise Financial Podcast. Thanks again for listening.
Yes, have a great day.
You've been listening to PennyWise Financial, brought to you by Monarch Wealth Management. Constantine and David really care about their clients. They want to make sure you're happy, so you'll continue to hire them. There's no commitments, and clients are free to leave whenever they want. Think about being able to pick up the phone and call someone for guidance and advice on almost anything, from buying a car, selling a home, buying vacation properties, or even selling a business. Reach out on the website at monarchwealthmanagement.com. There are 2 offices in Rochester and 2 offices in Buffalo. Reach out to us on Facebook, LinkedIn, Twitter, and YouTube, or call us toll-free at 800-480-1580. That's 800-480-1580. Until next time, this is PennyWise Financial, signing off.
The opinions voiced in this program are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which investments may be appropriate for you, consult with your attorney, accountant, and financial advisor or tax advisor prior to investing. Securities are offered through LPL Financial, member FINRA, and SIPC.